what this portion will be is we have quite a diverse group of people up here that can all speak to the built environment from different aspects. And we're going to ask them each to take 1 or 2 minutes to answer a question for us, and then we will open it up to the audience. To my left here is Brad Stelfox, who is a landscape ecologist. So he has created a wonderful software program that really brings in multiple areas, including economics, how we use the land, and speaks to a lot of the things that Larry was talking about in his presentation. And then we have Erik Backstrom, who is a senior planner with the city of Edmonton, so really knows the nuts and bolts of the realities of implementing a lot of these ideas. And then we have Dean Cooper here, who is a transportation planning engineer, so a lot of the transportation issues that Larry was talking about. And then, of course, you've all been introduced already to Dr. Larry Frank. And then on my far left is Dr. John Spence, who is an associate professor here with the University of Alberta. He is doing a lot of built environment research and really looks at how people live sedentary lives, sort of know the beast, so that you can address it and increase physical activity levels. So what I'm going to do is just ask each one in turn, again starting on my left here with Brad, to talk about very briefly, from your perspective of your discipline, what is the key issue that needs to be addressed in terms of the built environment?
Thank you, Tanya. Very quickly, and I'd find that I agree entirely with the presentation that Larry gave us. The key issue is around our current strategies of residential, with a key dependency on rural suburbia growth, and what that means in terms of physically separating where we sleep from where we work, where we buy our commodities. Secondarily, this tremendous externalization of the costs of an inactive lifestyle. I think there's very few penalties and few incentives that try and turn that trend. So we've externalized it and created a key liability that's being passed on to subsequent generations. Dependency on automobiles, maybe just to bring a few numbers from an Alberta perspective. We've got about 250,000 kilometers of roads in the province, growing at about 4%. This year alone, we traveled 26.3 billion kilometers in vehicles in the province, and since our birth in 1905, we put on 400 billion kilometers of travel in Alberta. Tradition, I think a lot of current generations have literally forgotten old ways of travel, like bicycle traffic and walking. I think we actually have to relearn skill sets that our grandparents knew. Body weight, people find travel by walking to be just uncomfortable. So it's this vicious cycle. And exposure to risk. I think many people have stopped walking and bicycling because they feel that there's both a physical risk from vehicular traffic and also personal traffic. So those would be some of the key issues.
All right, thank you.
We were asked the question of what's the biggest problem in the built environment, and Larry's presentation talked about some things that are non-built environment, things like there's serious economic factors and political decisions, some social issues, and definitely technological issues. But when I think about the built environment, it's definitely, as Larry and as Brad have said, it's the low density segregated land uses. We're really good at separating things out, and that affects physical activity in at least a couple of ways. The way we build our communities is actually we're fairly good at building them for recreational purposes. So if you want to walk your dog, or again maybe walk down the cul-de-sac to see your neighbor, the neighborhoods are often built with good connections to ravines and trails and so forth. But it's those utilitarian trips that Larry was talking about where we fall down. And as the city grows, we are simply getting farther and farther away from the purpose, from destinations. So I took a look at the city's household travel study, which was done in 2005, and it said that the average trip distance, any trip made on an average day in Edmonton, was 7.2 kilometers. And so I said, well, how far is that? And so from this building, from Lister Hall, 7.2 kilometers is Heritage Mall or Century Park down on the south side of the city. You see, if that's your average trip in the city of Edmonton, that's not including people who live in Sherwood Park or areas on the edge of the city or the edge of the metropolitan area. If that's your average trip, it's just not walkable. You just can't walk, and you can cycle, but it's a bit of a chug even on a bike. And so to give people more of an opportunity to be active in transportation, you got to reduce those distances, and the ways to do that are changing. I guess, looking at the things that I'm involved with, changing your land use rules. Larry talked about how zoning in a lot of cases makes it illegal to have walkable communities, and that's exactly right. I could be critical of people who help create built environment, or consumers or developers who build them. But I like to look at ourselves, and I know the city could do a much better job at making higher density, more walkable communities attractive. We could seriously improve our zoning bylaw, for example, so that people in existing communities who have the opportunity to have densification or new developments would see that as a benefit and not something to threaten them. We can come up with new subdivision regulations, such as the ones that Larry was talking about. And then I think we could also do a better job at addressing, through research and other things, just some of the more selfish aspects of the NIMBYism that we often hear about, and that often stymie attempts to make more walkable communities. So those are some of my thoughts on the problems and then some of the solutions.
Well, it's definitely a diverse and complicated issue, and it's hard to know where to fit oneself into a row of chairs like this going across. With regard to the built environment, even before I heard Larry's talk and read a couple of his papers, what I had thought of was that it's the lack of opportunity. What keeps us in the built environment from being more active? And I thought it boiled down to lack of opportunity. Now, you can, I think one important factor, and it was alluded to, is that we have what we have. And so we can talk in academic terms or in philosophical terms about whether our built form is good or bad, but we have to deal with it. We did a study on some transportation aspects of St. Albert a while back and sat down with the politicians there, and those, we ended up having to recognize that even if we started building Amsterdam in all of the rest of the land that we have available that isn't built, that isn't going to solve the problem. You'd still have 95% of Edmonton being what it is today. So we have to, I think, look at it from a point of view of practical solutions, things like adding pedestrian links if you can, and so forth. So that was the thought I had, was that a lot of it revolves around looking for ways to add more opportunities to be active in our daily lives. And then when you start to think about it beyond that, clearly you can't silo it just into built environment. It works into all of the other elements of how we make our choices on a day-to-day basis, trying to fit in all of our competitive time elements and so forth. So because I'm supposed to be the traffic guy up here, I thought one thought I could throw out was in terms of things that affect people's, the kids' ability to get on their bikes, or a seniors' ability to go for a walk. And I was thinking that within a neighborhood, traffic speeds can be very influential on that. And so it's a thought I've had as I've walked around my neighborhood is people are fairly comfortable with the idea, not with police enforcement, but the idea that you drive down certain roads at certain speeds. People don't drive 120 kilometers an hour down 114th Street. They may go more than the speed limit, but they don't go way more than the speed limit. Certain roads feel certain ways. And if you think about your neighborhood road that you live on, people can drive down that road legally at 50 kilometers an hour. And if you were actually to put enforcement out there, they would be looking at 55 or something before they would hand out a ticket. So a thought for us to consider might be, is there public will out there to reduce the standard speed limit on every local road to, say, 30 kilometers an hour so that it would be more walkable?
I guess you've already said your piece. Is that it? I'm not a planner. I don't have a background in planning, but I'm very interested in how people come to environments and interact in environments. And I'm going to say something a little bit different than what we've said here, and take a bit of an anthropological perspective on this. And that is that human beings over the history of our existence have really strived to be efficient in that energy balance equation that Larry put up there. If you think about it, up until about the basically the Industrial Revolution, we were living in a negative energy balance. We were spending almost more energy to go and get the food, the calories that we needed to put in. So this issue of obesity really was a non-issue. There was a few people in royalty that could plump themselves up, but most people were just struggling on a daily basis to find their calories. So I would ask you, why would you expend energy? We have evolved to be very efficient physiologically and psychologically. Why would you take the choice to walk to the store when you could drive to the store and expend less calories? Yes, we'll go out and play our games and participate in sport because that's fun. But why, really? It just doesn't make sense. We could bring it down to this utilitarian perspective that Larry was talking about before. There's a cost there for us. We're expending calories. And physiologically, and I'm not a physiologist, but we have an incredible set of systems that will fight and try to prevent every calorie that we expend. People, we see it going on diets and lose some weight, but as soon as they go off those diets, they not only gain the weight back that they lost, but they usually gain back more. So our bodies, we're fighting against a biology that's saying, don't do it. Just absolutely do not do it. And if you think about it, probably the most profound invention in human history was the wheel. And now you're telling us to give up on that wheel? I don't think so. It's not going to happen. So we really are fighting this battle. I mean, it's humans who've created these environments, the built environment we're talking about. We're not idiots. We're idiots in a sense that we don't know about, for instance, the pollution and the effects of it. But it's going to be a tough battle. It's not about just putting some policy into place. As Larry's quadrant showed you at the end, there was a good chunk of people in there who had no preference for that walkable environment. I suspect there's a greater proportion of our population that's like that.
I'll just make one comment that retrofitting, your comment about retrofit's really difficult, and I think that you started to point out some strategies that can, speed, connecting some pedestrian connections, but there's also land use and infill opportunities. They may not seem like opportunities, but even if you were to map where commercial uses could go that are not currently allowed, or density could be, that's what you're doing, I'm sure, in your plan. So you have there may not be the political will today in all those areas, but in here and there, market forces might make it so that those opportunities occur.
Can we just keep yakking here? One thought, building on what Erik said, as well as the last comment there, is at my current point of sort of evolution in this evolving framework of how do we make change, I'm currently convinced that we need to make it, everything has to be done on a sort of an appealing basis. It has to be done because we have to be able to sell the benefits of having the lifestyle like along Granville Street, where you can walk out of your house and just head down the corner to the coffee shop and have that be a positive thing, so that the NIMBY it's not in my backyard, it's yes in my backyard, that I want this. Erik has been working on a project on 109th Street, a plan for 109th Street redevelopment, and I live in the neighborhood right near there, and when we were looking at that and working on it from two different points of view, that was what I thought was making it successful. Potentially, time will only tell. Was that we try to sell the benefits of, it's not that we're going to bring more commercial into 109th Street, but that we're going to be able to have a node of really funky little shops that we can walk to, and that'll be a benefit. And so to me, it seems like we have to, at least, if there is going to be some stick type measures that may be necessary indeed, some more restrictive zonings or disincentives to driving and so forth, that at least to be selling it, you have to at least balance it off with the carrots and the positives. And I think right now that the path to success is more looking where all the positives can be and selling the appealing nature of things as opposed to the dire consequences of, and people don't really necessarily think that that'll happen to me. They think, oh, all those other people will get diseased and fat, but it won't be me. So I think the positive element is quite important when we're trying to deal with human change.
We'll take a question from the
Okay.
audience. Dr. McPherson.
Yeah, I have one question. Would you care to comment on where the two examples you used were Atlanta and Vancouver? Could you make a comment about the cold weather climates where you have winter 7 months of the year? How that might affect what you're talking about? Okay, that's good.
It's a challenge indeed to deal with. I'll start by saying that the data from Europe, where we have good evidence about how much people walk and transit use, is much high. Is really high in Scandinavia, for example, and in Holland. So part of this interpretation that that physical activity is only feasible in the warmer climates is of course, we know that's not the case, but there is no question. Like I was thinking the other day, I was going out for an errand, and it was beautiful in Vancouver. We haven't had sunshine for a while. And it was nice, and it was like I no way. So I'm a fair weather biker, and I realize that a lot of us make that choice. So there are things that we don't understand yet, the mediating effect of weather, how weather impacts the relationship fully, and it's for different people. It's different tolerances, but there's no question. So in terms of design, we have to be sensitive to that, and that may speak to the need for really in cold weather climates a level of mixed use that might be higher. That it just can't be that far, and it's not. It's going to need to be a certain distance, and then along that pathway between different types of uses that are complementary, there need to be certain treatments. So those linkages, at least between high-density residential and nearest grocery store, that has to be a pathway that's covered in some way, at least part of it. Awnings, there are some treatments that you can use, and actually we underuse them, but they can be very, very helpful. I don't believe in sort of the spaghetti of, I look at Minneapolis, St. Paul has a whole lot of sky bridges, and it takes the life off the street. But here, there may be, and you have some of that, and it's necessary in certain spots to have the sky bridges. One comment I wanted to make on the incentive part, and I hope that partly answers your question, but I think it has to do with the distances that we travel between different kinds of uses. In this climate, if you really want people to walk, you're going to have to look at those distances being fairly short, at least in the winter for that purpose. On the incentive side, on the carrot side, there's a lot that you can do. Tax abatement, where you want, you can forego impact fees in areas where you want development to go. There's I'm sure you're aware of all the density, all the bonuses and ways through zoning and through development regulation and different ways. There's a lot of mechanisms available to incentivize the kinds of land use patterns that would be more walkable. But the regulatory block, it's more like removing. There's a book called Zoned Out. Jonathan Levine, professor, University of Michigan, wrote, and really talks about getting out of the way. If we could do that, if we could just make it legal, so it's sort of not the regulatory stick, it's more eliminating the regulatory barrier and then also creating the incentive carrot at the same time.
Okay, Brad had a comment, and then we'll have a question from the audience.
I was just going to follow up on that issue of how much effort we'd put in retrofitting existing infrastructure. So we have what we have, and these are key issues we have to deal with it. But I think we also need to be mindful that we typically roll this capital over every 4 to 5 decades. If you were to fly over Alberta today and look at all settlements, you'd find it coming somewhere between 900 and 950 square kilometers in the province of Alberta. That's how much we have in cities and towns today. When we simulate this province into the future, even with fairly conservative estimates, by the time we'd be in this room, say at the bicentennial, so 2105, this province will be about 12 million people. and the urban footprint will be somewhere between 45 and 5,500 square kilometers. So the point being is that we really don't have much urban capital today relative to what we're going to have. The majority is yet to be built. And this speaks to Larry's comment about needing a systems type of approach where we actually internalize the true costs and we look at some sort of harmonization between transportation, environment, and health. And with that kind of approach, we can build by objective. We can figure out where do we want to be in 20, 40, 60, 80 years. What types of conformations of communities give us the kind of lifestyles and physical fitness we want. Right now, we don't look forward, we look down. It's a walk every day. We just look down and deal with these ad hoc tactical level issues, and there's very little attention spent on proactive planning by objective. So yeah, we've got to retrofit the communities we have right now, but boy, we have lessons that we need to learn and apply those lessons in terms of the communities that we're going to build. You know, as we build the next 4,000 square kilometers of communities in Alberta, what are they going to look like? Are we going to repeat these mistakes?
Thank you. So we have a question.
I lived in Alberta, moved to Vancouver, lived in the Kitsilano area of Vancouver, and have since moved back and live on an acreage. And the point I want to make is that I see people valuing large houses. And the only way that you can get larger, bigger houses is to keep moving out. There's so much room for infill in the city of Edmonton. Really exciting creative infill, but you have to change the culture that a small strata title is an okay place to raise a family. It was a huge shift for me to realize that I could have my kids in a small strata title and we could have a good quality of life versus the huge houses that I see going up. And I have concerns that we need to start taxing those huge houses more because they are using so much more of our energy.
Does anybody want to comment on that?
A quick example. If you look at the fastest growing city in Alberta, that would be Calgary. And in the last 100 years, it's grown on average in population at 3%. In the last 100 years, it's grown on average in area at 4.5%. So its aerial growth is outstripping its population growth. It's in sprawl, primarily for that reason that you've identified. So by essentially attending to the needs of the developers, who can always make faster return on their investment by growing peripherally, we've allowed that to be the key driver that has fueled the way in which our communities have grown. And we've got what we've got, people, you know, big suburban lots with big suburban houses. And Calgary and Edmonton have led the nation at the wrong end of the spectrum there. They're in 1, 2 at the bottom. Calgary, for example, 1924, 4,500 people per square kilometer. Calgary, 2005, 2,000 people per square kilometer. Okay, so we've gone from 3,500 people down to 2,000 people per square kilometer. It's a classic example of sprawl.
We have another question there.
I have a comment and a question directed at Larry King.
This is our talk show.
Anyway, the person that spoke about changing the culture, I mean, that's key. We look at our society that's really geared towards the individual versus what is good for us as a community. And there's a group of us, we live in a mature neighborhood, in really badly planned infill comes at the community. And we don't have, you know, we're really looking at how do we build community and develop a sense of identity so we're on better footing when we actually talk to the big developers. How do we create a sense of connection where we let go a little bit of our own self-interest and work towards the common good, especially when we have young children. We're working with a wonderful architect and we're actually looking at creating a common space that brings people out of their houses. We're working with our seniors, we're doing gardening projects, we're creating a walkable destination. Now, Erik is one of our very innovative planners at the City of Edmonton, and I think we're probably 2 years away of making a case for some good support from the City of Edmonton. One challenge we have is a community as an organic whole. You know, we're talking about health, we're talking about seniors, we're talking about environmental issues. And city departments, I've worked for all levels of government, you know, we like to slice and dice all these things, and we have trouble working with the community as a whole. So I guess I'm asking you, Larry, do you have any innovative examples of community-driven initiatives that really get the attention of the city and help bring resources to combat NIMBYism and the idea that there isn't enough to go around, but we know there is? There's a question in there. I don't know if you got it.
I'm glad I don't have to repeat it, but it was very. I got the general flavor. So, how communities have any examples of where bottoms up process from the neighborhoods and from grassroots have really created and gotten the attention of government successfully? Okay. No, I don't know. Well, I'll give you a couple. One actually came from a developer, Randall Lewis, who's building a lot of Riverside County. He's building a couple 100,000 homes right now. This Riverside County is about 200 miles. It's 300 kilometers across. It's basically east of LA and goes all the way across California to the Arizona border. And so he's just out there knocking out subdivision after subdivision, and he's become interested in active living and this stuff. So we're getting developers that are feeling, I don't know, a couple different ways or reasons they are. So he actually, through the city of Chino, California, has gotten them to create what I think we need to do is create a health element to our comprehensive plans. What we have is in different places. So basically the upswell with the community and with this developer, he might be responding to some activists in the community and saying, we are growing out so fast with very tenuous water supply in a desert, essentially, and completely far from everything. And so, but basically the message is that what they've done is started, and we've written it. I actually am the consultant who's done the health element. And so what I know about it is that this is a model for California's general plan that will then be used in other Richmond. There's another city that's got some a much bigger amount of a lot more resources to actually start to build to get the way that plans are done to rally around health. Health is sort of here and there in little fragments, but there's no place that we don't train the students yet to do this that do long range planning to really have that focus on health within the planning process. So that's one example, and it did kind of come from the community more or less. There are a lot of other examples, I think, where neighborhoods have successfully rallied for pedestrian enhancements. Most of it comes in the form of traffic calming, and most of that comes in the form of speed bumps, right? So, but that's not really, I mean, it's a microscopic little example of, put a Band-Aid on that. It's not really getting at the bigger question at all. So I think more at the regional level, really getting the attention is very difficult. But the way to do it is to find a foundation. And in this region right now, there's a lot of money, period. A lot of potholes, right? So the idea would be to find, some philanthropic source that supports community grassroots. I mean, to have an organizational focus. In Atlanta, Ted Turner did that. He funded, and it doesn't take that much money. I think with $1 million a year, he supported maybe 9 or 10, maybe more, maybe 10 to 15 environmental or grassroots organizations. They weren't all environmental. They had, feet for all kinds of, and they were very, very effective and brought change to that region and forced that region to start to look at different things. And, that region's not changing so fast, in fact. But the reality is that it certainly got their attention. And I think without that kind of, it takes some private sector, non-governmental funding. And in Vancouver, I see this is not the case. We don't have that support. So all of the NGOs are actually need to go to, like Smart Growth BC, who I work with, a wonderful organization. They're not going to be the first people. I mean, if you look at who's really fighting, for change, they're doing a wonderful job. But there are other folks who, by David Suzuki Foundation, for instance, by definition, doesn't get money from the government. You cannot bite the hand that feeds you. So basically, we need to have that funding from from private philanthropic foundations to support the community level, the grassroots, or the organization will never occur. And what you get is one NGO actually competing against another. in a way. I don't know if I'm making sense, but this is what I see as a problem in Vancouver, and I think that we need to have that private sector support to get the NGOs organized to then approach government in a coordinated, strategic, integrated way.
If I can just add, Shelley, the health benefits that relate to the things that you're talking about are spread across various organizations or departments or whatever, and that's a challenge. But I think as you nurture your contacts in each of those areas, you can add up those benefits. So benefit here, 2 benefits there, 3 there, 1 there, and it takes more work, but you can bring those together into a collective larger benefit.
Well, we're giving it 10 years until our kids are out of elementary school. That's it. I'm walking away.
Okay. Okay.
I think we have another question.
I have a question. And I'm curious, and some of you have mentioned it, about the risk factors associated with walking. And often when we encourage kids to walk to school, it's always safety or the fear of what could happen. And I'm wondering if one of the partners should be some of our community policing organizations to help make sure we're designing so that it is the ultimate safety as to alleviate some of those issues, or is that a totally different factor? Because I think it prevents people from walking if they're a fear of what could happen on the road.
Yeah, that's a very good point. The irony is we're more safer now than we have been in history. In this city and in this country, crime rates are lower than they have ever been before. But we are much more aware of any crime that is perpetrated because of media. So we are more aware. I'm not saying that crime isn't an issue, but we can look at the objective data of crime rates in neighborhoods, which we do, and then we can go ask individuals in those neighborhoods what their perceptions are, and their perceptions often are much higher than the rate is. But I would argue there's no question that crime or perceptions of crime is a big issue in relation to this. So Larry mentioned in his talk that you could have a very nice walkable neighborhood, but if crime is there, which some of your Atlanta data seems to be showing may have possibly been playing a role, then it doesn't matter how nice your streets are and your locations are. And I'm aware of several initiatives where, as you called it, the community policing is being considered. But again, it becomes this issue of there's limited resources being spent, and if we have riots out on White Avenue after the Oilers win a game, that seems to be the biggest concern that we have.
We have another question.
Yeah, I just wanted to pick up a comment with regards to the cold weather climate and also pedestrians. I think here in Edmonton, I've come from Ottawa to here, and one thing I was finding is walking around, there's actually, first of all, like in Edmonton, there's quite a few missing sidewalks. Like you'll be on one side of the road and you want to cross safely, but you realize actually when you get to the other side, there's no sidewalk. So you have to cross the road again. So you're actually zigzagging up a road and obviously exposing yourself to, getting run over by a car. But I'd just like to congratulate the City of Edmonton because they've started the Sidewalk Strategy, which is addressing these missing links. Which I just really like to say that I think that's a great strategy. But I'd like to bring up the cold weather aspect because obviously we have snow here in the ground for a substantial portion of the year. And we also have a policy of the residences plowing their own section of sidewalk outside their home, which some of you I'm sure are very diligent in doing that first thing in the morning when you get up. But other people are not. So you actually, again, it's kind of a missing link problem when you're walking down and you're hitting a good section of sidewalk, but then you are flat on your rear end because you've hit a bad section of sidewalk. And of course, people with elderly, people who are elderly, we have an aging population, are not going to be going out in this circumstance. So one thing I would like to see in Edmonton is some addressing of a common plowing strategy for the sidewalks, because I think people are not going to go out if they're worried about falling or their safety.
If I could talk a little bit about the sidewalk strategy, I'm actually the project manager for that job, and the first thing I'd like to mention to you is a website. It's the city's website, www.edmonton.ca/sidewalks. if you haven't already gone there and sent in to me your list of where you feel sidewalks are missing, then why not? So if you have anybody who was, while the speaker or the questioner was talking, thought, oh, I've got some of those, please send them to us, because that's exactly where we are in the process right now, is trying to find out where these sidewalks are missing. And one of the strategies or philosophies that we're working on right now, for better or worse, it's kind of my thinking is that the city can't afford to do everything all the time. So one of the things we're looking for is missing sidewalks, and I define that in part as being sidewalks that are missed. So just because it's not there doesn't mean it needs to be there, but if it's not there and someone misses it, someone wishes it was there, please let us know about that. I think the question or the comment about sidewalk maintenance in winter is also, those sorts of suggestions is also what the project and the city is looking for. So if you have, thank you very much. Anyways, that's just as far as the process goes. It is an opportune time for people to make those sorts of ideas and questions known to the city.
One of the things that we're doing is trying to prioritize where pedestrian investments are made, working in Seattle and King County. And we're developing this, we call it the transportation programming tool. And basically we're going to overlay walkability and density. So pretty simplistically, but it's a way to predict where the links are missing, where the need is, and where the use would be the greatest. So where there's the most potential benefit of when you spend the money on it, that there'll be the most people using it, origins and destinations along it. You probably already have that in your thought process, but it's one way to use.
It's one of the reasons why I was really interested in participating in today's meeting, was to try to meet up with yourself and John and get a little bit more of that built into our work. The interesting thing is that if you're the city, that sort of, the strategy, if it's based on that, that makes sense, but they get phone calls day in, day out from people that say, well, I don't care about your density model and all that. I just want a sidewalk in front of my house. So there's that NIMBY individual vantage point that needs to be overcome at all times as well.
And just comment, as an individual citizen, we've talked about sidewalks for walking, but the other one would be our bike paths. We have bike paths that go to nowhere. We have paths that lead us right up the corridor of 114 towards the university, and then you hit a sign that says absolutely no bicycles on the sidewalk. There's no point where it tells you you're now leaving a bike path going to a sidewalk. It just boggles my mind why we would funnel people up there on bicycles and then tell them to get on the street with a bunch of mad vehicles that just want to get through that congestion, which now is a total nightmare, but I understand the reason why we're doing it, because we're building an LRT that about 5 people will use. But anyway, if there's anybody out here that can do anything about our bike paths, and I know there are some very good people who are involved in this, I suspect they need more help to go further up, but it just boggles my mind some of the things we do there.
I want to tell you about another website. On the City of Edmonton website, if you go under transportation, there's a link called Bicycle Transportation Plan Update, and I'm doing that as well. Or I and we, I in the collective sense. And the people from the City of Edmonton that are involved in that are here today, all of them. So they're hearing and involved, and they're quite active in actively participating in this sort of discourse and dialogue.
Now you all know how John gets to work. I think we have a question here in the front row.
Hi. I have a couple of points. Number one, regarding your safety, or somebody said safety. It's really, it's safer now. Actually, I have a story. When I was 8 years old, I was abducted on my way home from school by somebody who said his mother needed groceries, and would I come and buy groceries with them? I mean, what a line I fell for. Fortunately, I won't go into the long details, but I did manage to escape because my mom had taught me about the old kick in the groin thing, and he let go of me, and I managed to escape, etc., etc. So as a mother with children, I had kind of, should I let my kids walk to school or should I drive them to school? Fortunately, I'm of your ilk and believe in active living, so there are things to do like the walking school bus, Go for Green, for example, the walking school bus, the seniors in the neighborhood that will help kids cross the street. So there's a lot of things that we do now. So that's terrific, and I'm here to talk about it. But I had a couple of other things. We've been talking about the built environment, and in my mind goes to buildings downtown. I work downtown, and I think about that as being the built environment. Is that a fair question here with this panel? So we're getting much better now at making building owners or builders put in bicycle storage areas for the cycles, and putting in showers so people can shower. How do we go about getting people to put in stairwells and make it mandatory to put in stairwells in buildings so people can use stairwells? And what about escalators? I noticed that there's a lot more escalators going in buildings, but they put them in and they put single escalators, and sort of like Toronto. You're from Toronto, maybe you know. In Toronto, I think they, it's the old stand right, walk left thing. So if you put in double escalators, that's great, except that we need to change culture so that you can actually walk on one side and stand on the other. And the other thing is, why put in single escalators? Why don't we put in double escalators so at least that can happen? If you put in a single escalator, you just have to stand there too. Maybe I'm too type A, but there's an opportunity for activity. So I don't know who you speak to about getting those kinds of things mandated in terms of the building. And one last thing, R2 zoning. How do you get the community to accept 2 houses on one lot for R2 zoning?
I'm just going to start, and then I'll turn it over to our planner. There are some examples where you point out we spend most of our time indoors, and here in this region maybe even more proportionally. So stairs really matter for physical activity, and there's been a good bit of research on that, and it has to do with building codes, I believe. And I don't know if you deal with the building codes. Okay, so so there's zoning is the parcel level, and then of course subdivision. So it's the actual design and requirements for different kinds of buildings, and that would be the regulatory. Whoever's responsible for building codes, that would be. And there are models. Centers for Disease Control did an experiment. A bunch of other experiments have had on stair use and placement of stairs. There's some research out there on that and showing it really matters. So you're right. I'm actually concerned about one of the things we look at walkability and look at how physical activity is related with it. I presented that briefly. It's different, the results, than looking at if you're just talking about walking. Overall physical activity may be higher in more walkable areas because people are walking up and down stairs, because in more compact environments you have houses arranged vertically. So the elimination or presence of stairs in homes can be a huge difference of how much exercise people get. So I think we should be looking into that more carefully, and I think there's some evidence to help.
We don't want more stairs.
A couple things just in terms of the escalator and stairs. One thing, we have an aging population, so we need to be figuring out how we're going to be able to move people up and down and around. So there's a practical issue there. Secondly, there becomes issues around safety in terms of stairwells. For instance, in my experience in going to the U.S. after 9/11, oftentimes I was finding the stairwell was locked and sealed at the bottom, so you can't even get out of the stairwell. And Diane Finegood, who's the director of the Canadian Institutes of Health Research, the Institute of Nutrition, Metabolism, and Diabetes, was here for a meeting a couple of years ago, and she was over at Campus Towers, and that happened to her. She walked down the stairwell in Campus Towers, and she couldn't get out. But not only that, she couldn't go back up and get out the door because it was sealed there too. So it was only because of her constant pounding on the door that she eventually got out of it. So it's a perfect point that goes back to what Larry was talking about before. We may resolve one issue, safety, so we're going to seal up our stairwells, but then we prevent people from being able to go up and down. So it's again sometimes about this issue of health. Health is not an issue of a Ministry of Health, or as some people would call acute care. Health is urban planning. It's a lot of the different things that people in this room do, because health isn't just about treating people once they're ill. It's about preventing it. And I think in this province there is some understanding and dialogue around that, but it sometimes gets too insular in the way we look at it. Now, I'm expecting you're going to tell us something here.
Yes, I'm Judith, and I have a message for Larry. Your cab is arriving. And I wanted all of us to be able to thank Larry for being with us today. And I hope the panel discussion doesn't shut down with his departure, but he does have to depart.
The question also related to zoning. The question was how can an area be zoned to allow two building or two units on one lot? City council sometimes gets these one-off what we call spot zonings, where a property owner just in the middle of a neighborhood somewhere says, my lot that's zoned for single-family housing, I want to build a duplex or a semi-detached 2 units side by side. And sometimes city council spent 3 hours dealing with the resident or the owner who wants to do it and the community who's against it. So that's not the right way to go to increase the density to make our communities more walkable. There are neighborhoods in the city, and Bonnie Doon is an example, where there are a lot of single-family dwellings, but the overall zoning for the neighborhood allows some of that intensification. So it would allow a duplex or maybe a fourplex. And then there's neighborhoods that are right next door where no, it's single-family only. And so those are things that we could change. We could change the zoning on a neighborhood or on the basis of many neighborhoods to allow that kind of intensification. Right now, the city council, a big issue is affordable housing, and the direction from city council to the planning department is make it more or get rid of some of the rules that prevent secondary suites or garage suites or granny cottage in the backyard. Makes total sense. It's a good way to densify the neighborhood without changing the character, but going from a 1-story bungalow to a 4-story apartment building. And so that's something that we're working on right now, and hopefully we'll do more of as well.
I think we have a question.
One of my colleagues calls parking lots fertility drug for driving. So I think that the problem in the first place is that it goes back to some of the comments we had earlier, but we make it so easy to drive, and by providing easy parking, we fall into that. Now, not to be too controversial, but the advertisement for this session highlighted where you could park. I don't know if you noticed that. It's because that's a concern. We want to be able to get here, and even though we're in a fairly transit accessible location, and so I think that sometimes there needs to be a decision, especially at the university, which is densifying and a lot of new buildings and growth in programs, to say we've got the transit. If we really want to make that very costly investment in the LRT viable or cost effective, we need to not build as many parking lots or parkades and just say use the alternatives.
Yeah, that's actually a good question, and I think there's an interesting little social experiment or natural experiment that's going to take place for us in the next couple of years with the new Edmonton clinic that's going to be constructed here. So basically, I don't know if all of you are aware, the Jubilee parking lot is going to disappear. There's going to be a building that's going to start on 87th Avenue and go all the way to 82nd Avenue. It's going to encapsulate the LRT station there. It's going to be about 4 stories high. There'll be a couple of bridges that will go from the east side to the west side of the street there. But if you can imagine that Jubilee parking lot, if you travel around the university during the middle of the day, usually it's full. There will be no place for those cars to park. There's going to be some temporary parking lot on the other side of the Jubilee, but it will be nowhere near that size. The university has already sent out notices basically trying to, they're very worried about the uprising that's going to take place, because you can imagine there's going to be some serious anxiety around that. So it'll be very interesting to see what the choices or options will be for people. I mean, in one way, it's a perfect example of how we will have constrained their travel pattern, and maybe perhaps more people will actually take transit in there. But the other thing that was commented on, there's about $1 billion of construction taking place on the campus right now, and with that Edmonton Clinic, there will be billions more taking place. So, but it's still probably some of the cheapest parking in the city here. So if you wanted to do one thing, you could maybe raise the prices. Now, if any of my colleagues are out there, don't start throwing tomatoes at me.
I just wanted to give you another website, but this one I have nothing to do with it other than I look at it once in a while. It's Todd Littman's website in Victoria, the Victoria Transport Policy Institute. And I don't agree with everything that Todd Littman puts on his website, but I do find that he takes what I referred to earlier as kind of tries to find positive ways of dealing with those sorts of questions. He's pretty realistic in the sense that he understands that people want to drive, if that's their anthropological nature. And so there's a lot of good information on there for anybody who is interested as a citizen or as a voter, or as a possibly if you're working in the industry, about things like the costs of parking, and parking subsidies to staff, and how you can cash those out. And people will at a workplace, for example, you can get it to the point where a company can save money on its parking by giving staff free money to take a bus to work, type thing. There's all sorts of ideas like that are on there. So it's a good place to start, finding ideas that you can talk about in your community or with your politicians, etc.
Thank you. I have a comment that was actually more appropriate for Larry than who's left, but I thought I'd go ahead and make it anyway. There seems to be a philosophy, and I think in many respects it's good, but the philosophy is build it and they will exercise. And making the connections and links is positive, and making a community more walkable in terms of building sidewalks is a great idea. But I thought I would just be a devil's advocate and point out the downside of some of the suggestions that Larry made, taking a cul-de-sac community and making a link so that somebody can walk 200 meters instead of 2 kilometers takes away an opportunity for exercise. And the comment that John made about the cultural and anthropological notion of minimizing energy expenditure is where we need to work and overcome and convince those people that walking the 2 kilometers would be better for them. And maybe the people that have the walkable environment and can get to their destination within 1 kilometer need to be convinced to take 2 kilometers to do it.
I think it also has to do with the nature of the 200 meters or the 2 kilometers, that if it's a pleasant 2 kilometers, then it's a choice, or it's an opportunity that's there. If you want to have, if you want to get there quickly because you're pressed for time, you've got one option. If you want to go for more of an exercise, and so it has to do with the quality as well as the quantity.
And just one comment there, some of the advantages of cul-de-sacs, because we interview people and ask, well, why do you want to live in this neighborhood versus another? So cul-de-sacs, as Larry pointed out, there's major safety issues there, traffic safety, and also this idea that we're our own little island, so break-ins and so forth supposedly will be less of an issue. But one of the things I find ironic with that is that cities now are passing bylaws about kids playing on the street. So the whole reason why we choose to go to the cul-de-sac is because our kids can play out in front, ride the tricycle in the low roundabout. But actually just recently I was reading an article from Calgary where a family had moved into this neighborhood and the kids were out playing street hockey, and a neighbor phoned and complained, and there is a city bylaw that says children cannot play on the street. So the way the newspaper played it up is the couple are standing there shrugging their shoulders and the kids are standing beside them looking very sad. But the whole thing this family said is the reason why we chose this neighborhood was so our kids could do this, and now we find out there's actually a law out there that says our kids can't play in the streets. And we've heard over the years kids playing street hockey and the cops come and tell them they have to go away somewhere. So it starts to befuddle us as to what's the reason then why we have that cul-de-sac.
I have a couple comments, and not so much a question, I guess, but just about the cutting back on parking lots and things like that for people who drive. I live in deep Millwoods, quite east, and I would love to be able to take transit to work, but when I started my new job, I actually went on the website and called them, and they had no options for me other than being getting dropped off 5 blocks from where I work. I actually picked where I live because there is public transit right outside my doorstep, but I now can't get to from where I'm dropped off to my work very easily, and sometimes there's a lot of boxes and bags and stuff that I have to take with me, so that doesn't make it very easy. So now I pay $70 a month and I park underground, and so it would be very easy for me if there was better public transit. Obviously, I would be more than willing to do that. The other comment about gentleman's comment over here, and I completely understand what you're saying from a physical activity perspective, but I deal with a lot of people who have physical disabilities, and making these links is also very good for people who are in wheelchairs and things like that, because it makes them easier. It makes it easier for them to be able to access amenities in the community, and also makes those communities more attractive to them. So now they don't have to try to live downtown where it's easy for them to get around and pay a lot of money. That's a huge problem because a lot of these people are on programs like AISH and they can't afford to live in these denser communities because it's so expensive.
Just one comment on there that you cannot take a city bus from the city to the airport. I don't know of another city in Canada where that's the case. What? Victoria. Oh, Victoria, yeah, Victoria. Yeah. They're all rich out there anyway. But I just find it bizarre that you can't take the city bus. It's a big highway. Why can't we do it? So it seems to be this big revolutionary thing now that we're going to have a bus line in common with Leduc, and it's going to stop in Nisku. But it's not because of the airport. It was to get workers to Nisku. That's the reason why this bus line has been put in place. But that would be another example. If you lived out in some of those areas, you have no choice. You would have to drive in. I mean, it's the way it's you guys. It's your fault. Hey, did you mention that aren't you a suburbs guy? Don't you develop suburbs? Isn't that your...
No.
Oh, okay. You're lying.
I'm a lapsed suburban planner. Clearly, we need to improve the transit system, and that there are efforts that are being made. Larry talked about the funding priorities, and that's something that I'd like to just highlight again. Look at where the dollars go, and yes, right now we're spending a lot of money on LRT, but over time, Brad talked about setting our goals and what our aspirations are, and working towards that. If we aspire to a really walkable community, it needs to have good transit service, and we've got to adjust our funding mechanisms towards that.
I've seen lots of advertisements for out in the Sprawl neighborhoods saying how walkable they are and showing pictures of people walking through parks. And Dr. Spence said we're willing to expend a few calories getting to the goal line on the playing field. But a lot of time walking and such pursuits are seen as recreational activities and thus don't get any respect from the powers that be. Because walking and bicycling is something you do after you drive to work and after you drive the kids all the way across town to school and after you drive all the other way across town to the big box store for the groceries and such. So how do we convince powers to give these seemingly recreational activities some respect? Remembering, and I've talked to Dean about this and I've mentioned in other contexts, that the split between the recreational and the utilitarian aspects of walking and cycling and active modes of transport is often very artificial. Just because you go to the grocery store with a smile on your face, or because it's a nice day and you take the 2 kilometer walk or ride rather than the 200-meter ride, it's both recreational and utilitarian. So how do we bring these two aspects together? And Dr. Spence, if you want to talk bike paths, a lot of people in this room will talk to you.
Okay, good. That's a really good point. I think the issue around sport and physical activity in a leisure context, it's not very difficult to talk to the relative agencies about those issues. They understand that context. And in fact, leisure time activity, if you believe the surveys that have taken place over the last 50 years, has actually increased in North America. And in Canada, we're second only to Finland over the last 20 years in our increase in population levels of leisure time physical activity. So the type of activity that we're choosing to go out and do. But at the same time, there has been on the order of hundreds of % decrease in energy expenditure in the workplace. So we're no longer doing manual jobs in the workplace. We're working on computers. Just about in any industry now we're working on computers. Even farmers are using computers to plot out their fields and how they plow and so forth. So it is this issue of the workplace and transit-oriented activity that I think is a bit more difficult for government agencies and health agencies to deal with, because it's not really part of their domain. We deal with people over here. We don't deal with people going to and from work. The transportation deal with people going to and from work, and it needs to be an efficient process, so we don't want congestion. But they don't do it for the health purposes. In fact, I once heard a traffic engineer say, you know what? I was always schooled to reduce vehicular pedestrian incidents, I think was the term, basically getting run over by a car. So the best way to do that is don't bring people to an intersection. So therefore, don't build a sidewalk. Then I don't have people getting to my intersection. So that's a perfect example of who actually deals with this stuff. So I haven't really helped you there except to just say I can explain why it's not an issue for them. But I don't know if Erik or someone else has something.
From a excuse me, from a facilities point of view for bikes and pedestrians, I think it's fair to say that there's some synergies there that can, they're not always identically, they don't always go in exactly the same places. River Valley Trails are a good example where they can be used for commuting, but they're not always the most direct route. But in looking at roads, shared facilities, for example, on an arterial road, it could be to get you from point A to point B, or it could be for part of going for a recreational trip. So I think the point is that they're not always mutually exclusive. In a lot of cases, you can tap into different reasons for building the facilities, which I think is a good thing.
Okay, unfortunately, I think we have to wrap it up now. But I'd really like to thank all our panelists. They all had excellent perspectives, and also thank the people who asked questions, because we were really hoping for a good response, and we certainly got that.